Hi. So we're going to now, continue with the chapter which we've already started in the previous lecture. That was about the growth hormones in the anterior pituitary hormones. So we've done the various types of growth hormones and what are the other drugs which are used, which are growth hormone analogues. They're used as such. So now we're going to talk about the something which is opposite to that of growth hormone, and that is inhibiting the growth hormone. They are called as growth hormone inhibiting hormone. So as we did yesterday, this is also released from the hypothalamus. Somatostatin, growth hormone inhibiting hormone. It is released from the hypothalamus and it acts on the anterior pituitary, but its action is to decrease the release of growth hormone. So what it does is it inhibits the growth hormone release. And not only it inhibits the release of growth hormone, it also inhibits the release of insulin and even the glucagon from the pancreas. So you remember somatostatin does that also. It inhibits the various GI peptides and it there are vasoconstrictors, so they also decrease the splanchnic blood flow, and because they do that, they will decrease the portal pressure. Right? These are the various actions. Now, somatostatin itself is very short acting, so you cannot use it as such for therapeutic purpose. So what we did is we made various analogues of somatostatin, so they are comparatively longer acting and they can be put to therapeutic use. So analogues of somatostatin, we have Octreotide, we have Lanreotide, and we have Pasireotide. So they're all long acting and they can be used by parenteral route as subcutaneous, they're intravenous. So they're available. Now in these, this Pasireotide, apart from the similar actions as is seen with the somatostatin, it also inhibits the release of ACTH, adrenocorticotrophin hormone, and therefore it will decrease the cortisol formation from the adrenals. Now the various uses of analog of somatostatin, you can remember, they all end with the tide, T-I-D-E. So remember the tide only, and the uses you can remember by this mnemonic tide. T stands for they can be used in various tumors of insulin and glucagon, right? Because they are inhibiting the release of insulin and glucagon. So tumor of insulin is like insulinoma, जहाँ पे बहुत ज़्यादा insulin secrete हो रहा है. जो glucagon का है glucagonoma, बहुत ज़्यादा glucagon secrete. तो वहाँ पे हम use कर सकते हैं. I stands for wherever there is increase in the growth hormones. And किस condition में growth hormone increase होता है? Yes, in the adults, that is called as acromegaly. Acromegaly. D stands for diarrhea. And ये कौन से diarrhea है? Basically, these are the secretory diarrheas. So वहाँ पर कुछ GI peptides because the gastric secretions कम करता है, so we can use in those conditions. और कौन से secretory diarrheas are it is helpful in? For example, because of diabetes, because of that, because of carcinoid syndrome. ठीक है? Because can be tumor because of the enterochromaffin cells, increased secretions हो रही हैं, secretory diarrheas होते हैं, तब वहाँ पे भी हम use कर सकते हैं. Then even sometimes in irritable bowel syndrome, it can be used in these conditions also. E stands for esophageal varices. So there is bleeding from these vessels. So how is it helpful? Because I told you these are potent vasoconstrictors and they decrease the mucosal blood flow. So they will decrease the mucosal blood flow and patient will be relieved from the vasoconstriction. Decrease the mucosal blood flow. Right? Okay. Now, This is about somatostatin or octreotide. Now, pegvisomant is another drug which sometimes is asked in the MCQs. What is pegvisomant? It is actually a growth hormone antagonist. So it will act on the growth hormone receptor, and what it does, it is going to decrease or inhibit the production of insulin like growth factor 1, and जब ये produce ही नहीं होगा तो इसके actions ही नहीं होंगे. So therefore the best possible use of this drug is for acromegaly. So use is in treatment of acromegaly. Very simple, right? Easy. Now coming to another, these hormones from the anterior pituitary, which is called as prolactin. Now prolactin is released from the anterior pituitary, but it is under the control of prolactin inhibitory hormone. ठीक है, यहाँ पे कोई releasing hormone नहीं है, prolactin inhibitory hormone है, जिसका दूसरा नाम है dopamine. ठीक है, so dopamine acts on its D2 receptors, and it actually keeps a check on the release of prolactin from the anterior pituitary. And in case there is deficiency of dopamine, there will be no check on the release of prolactin, so increased amount of prolactin is going to be formed, and that leads to a condition called as hyperprolactinemia. And prolactin is evolved from milk secretion from the breast tissue, so that is also going to be more. Now, see, dopamine, there are certain drugs which are dopamine agonists and there are dopamine antagonists, on the D2 receptor. So what effect will they have on the release of prolactin? So जो dopamine agonists है at the D2 receptor, for example, drugs like bromocriptine, drugs like cabergoline. So they are agonists. So again, what they do is they are going to decrease the prolactin secretion. Decrease the prolactin secretion. So where can they be put to use? Again, they can be used in hyperprolactinemia. They can be used even in conditions like, they have been found to be effective in Parkinsonism because they are dopamine agonists. Then they have been found to be effective in type 2 diabetes mellitus, right? Now coming to the antagonists. Now D2 blockers, actually there are drugs which are not purely just D2 antagonists. They are some other drugs used for some other purpose, but they also cause D2 block. For example, we have, a prokinetic drug like metoclopramide. So what it does, it also blocks the D2 receptors. Then we have antipsychotics like chlorpromazine. Chlorpromazine, it also blocks the D2 receptors. We have haloperidol. So they are used for psychosis, but their side effect becomes they are blocking the D2 receptors, right? So what they do, they are going to cause an increase in the prolactin secretion. So their side effect is hyperprolactinemia. Right, so this was all about the anterior pituitary hormone. So we have covered in this primarily the growth hormone and the growth hormone releasing hormone and the various drugs which promote that, and what is the use of growth hormone, what are the use of insulin like growth factors, then what is growth hormone inhibitory hormone somatostatin, that we've covered in today's lecture. And this is very important, somatostatin, because itself it cannot be used or because of short half-life. So we have various analogues of somatostatin like octreotide, lanreotide and pasireotide. So tides, they're all peptides, right? So they cannot be given by oral route, so they are given by some parenteral route. Use, you remember the tide and you remember the mnemonic tide here, the last four alphabets, and T is for tumors because it is decreasing the insulin and glucagon secretion release. So it is used in tumors like insulinoma and glucagonoma. I is for increase in growth hormone secretion, or सबसे ज़्यादा problem क्या होती है उसमें, that's acromegaly. You can use it in those purposes. D is for diarrhea, secretory diarrheas के लिए use हम कर सकते हैं. right? Then E is for esophageal varices or esophageal varices के लिए इसलिए because these are potent vasoconstrictors and they can decrease the mucosal blood flow. That's the use of these drugs. Then pegvisomant is an antagonist of growth hormone and these are used especially for acromegaly. Then I did prolactin. Prolactin में main जो important चीज़ है, prolactin is under the control of dopamine and dopamine control करेगा उसको, और dopamine agonists हैं, they will decrease the release of prolactin and therefore they can be put to use in conditions like hyperprolactinemia. It also is in Parkinsonism and diabetes mellitus. While जो antagonists हैं, they are going to enhance the level of prolactin, right? Because they are going to block the effect of dopamine on B2 receptors. Prolactin will be relieved of its inhibitory effect. So that is what we are, what are they going to do. So with this, we come to the end of the chapter on the anterior pituitary hormones. So with the next lecture, I'll be coming with the next video. So stay tuned. Till then, please study hard. Take care. Thank you so much.